Hello, I'm Dr. Calvin Ross, and we do a lot of sports medicine, and I'm going to teach you how to treat yourself for a tennis elbow. Usually the problem is here in the elbow where the muscles come up and attach on the top, and it becomes very painful. What's happened is this muscle has become overused from this wrist doing too much extension. Going back, it's caused the muscle to shorten, and where the muscle attaches to the bone, it's become inflamed and it's very painful. We're going to give you a therapy called trigger point therapy, working to release the muscle tension so that it doesn't pull, and then I'm going to show you how to put some Epsom salts on it to soak overnight to remineralize the muscles, and I'll give you some exercises that you can do also. So let's get started. We have a half a cup of water. We put a tablespoon of Epsom salts. We're soaking it, and we've got some gauze in here that we're going to use to wrap it when we're done. And that can just soak, and we'll use that later. We have some paper towels to wipe off the lotion and any Epsom salts we might get. A towel over a pillow so it's nice and comfortable. And we have our tape ready to tape it so it can hold and you can soak it overnight. Get some lotion and simply spread it along the arm, so that your hands, or your thumb we're going to use, can get in between the two bones. We have two bones, as we know, in our forearm, and we want to go between those bones and push the muscle up towards where it's painful. When you get to the point in the elbow up high, where it's very, very painful, your pressure is much less, and then you stop. You come back down and you work the muscle a little bit deeper. It should be a little uncomfortable, but it should be bearable, not to the pain level that you have to wince or tighten. You want to be able to keep your muscle relaxed. So the idea is like a kneading or triggering the release of the muscle that has become over tight over time to break up what we call muscle adhesions or myofibrositis and get the muscle to lengthen. Thereby the blood flow can come into the muscle, taking the lactic acid away, and that's part of getting the pain out of there. So a muscle that's become over tight, we have to get that muscle more relaxed. And that's done by specific trigger point therapy, up and down the muscle, releasing the tension. You'll find certain areas that are more tender than others, and you can work on those a little bit more. And you continue to work the muscle back towards where it's painful, in the little bump here as you feel on the elbow. And that's just as simple as the therapy is. Probably about 6, 7, 8 minutes till you either get tired or your muscle feels like it's had a good workout. Stretching the muscle deep and up towards the elbow. You just continue to do that. You find the areas that are tighter, you can work on those a little bit more, work over them. Go up to the next level, and you're going down between the two bones. One of the things you want to watch out for is when you're pressing, is that you're pressing only on the muscle, and when you feel the hard bone down underneath your finger, you don't want to put too much pressure. You could bruise the periosteum, the covering around the bone, and cause more pain. That's not our object. So you just continue working the soft tissue, the muscle, back towards the elbow, all the way up to where it's right where the elbow bends and where there's a little bump right here on the outside and top of the elbow. That's where you're bringing all the muscles back to. We're actually lengthening the muscles now from the wrist up to the elbow so that the muscle can relax, bring in fresh oxygenated blood, take the lactic acid away, which is causing the pain. So once you've worked that as long as you want, you can simply wipe the lotion off. And then we're going to go ahead and show you how to put some Epsom salts on it to soak overnight. Those are calcium, magnesium, sulfate salts, and they work very well in getting pain out. So we take our little gauze, wring it out. We don't need to have it drippy wet. We want to just squeeze it, let most of the water come out, not squeezing it hard, squeezing it so it doesn't drip too much. It's about 45 inches long, wraps around the arm 4 times. So the Epsom salts are now soaked in here. We can just simply wrap this around right where the elbow bends. And it doesn't have to be necessarily tight, just snug. And make sure that you wrap it right over that bone in the elbow where it's the most painful, because that's where you want to soak the Epsom salts in and keep that area soaking overnight, and that assists taking the pain out and will feel better each and every day you do it. You can continue to do this until it's better. It should continue to start getting better within the first 24 hours. You could do this daily, and you just wrap it like that. We've got some tape. We'll just tape it. You could then take a little washcloth and wrap it around, if you can leave it on all night, which I suggest you do, and put another piece of tape around it so that it doesn't get wet. Whatever gets wet from this Epsom salts when it dries is going to be pure white. It's not going to stain anything, it just kind of seems to make a mess. And you can also use the gauze after you take it off, because the Epsom salts and the salt is an antiseptic. So just rinse it out, let it dry, and you can reuse it if you want. So that's the actual muscle therapy for the trigger point therapy for a tennis elbow. Now we'll give you some exercises to do, and it's simply using the opposite muscle that is not been used, and you've overused this muscle. So the point being, the wrist has been used too much in what we call an extension going back, and not so much going forward. Well, how muscles work in flexion and extension, moving the wrist back and forth, when this muscle pulls down here, this muscle has to relax. When you pull back, this muscle contracts and the opposite muscle has to relax. That's the way the nerves send messages to the muscles. So the exercise for your tennis elbow that you can do, and it shouldn't be done, it won't cause any pain at all, and it shouldn't be painful. You basically, with a steering wheel in your car, you could use it with your other hand, and you're simply going to push this wrist this way with resistance, and then bring it back, and then push with resistance again. So just by interlocking the hand, you're taking your right wrist and you're pushing and giving it some resistance this way, and then you let it relax back, and then you push and you resist. And I would say do 20 to 30 of those exercises until this muscle starts getting fatigued. And when this muscle contracts, the opposite muscle that's causing the problem is now going to relax. And that's how you get the function back to your muscles that became stressful and they lost their function and became too tight and couldn't relax. You're going to massage them, you're going to put the Epsom salts on, you're going to do the exercises, and within a week or two, if you continue to do it, if it doesn't get better sooner, I would just continue to do it each and every day until it improves or is completely gone. This is a very serious problem, as you well know. If you're watching this video, it can get to the point where you can't use your hand, and it's pretty bad when you have to tie your hand behind your back. You can't even use your hand. You're pretty helpless. So your hands are very important, and this is a very important technique, and it works very well. Thank you.